Okay, so let's get right into it. We've all heard that rule, right? No food or drink before surgery. But have you ever stopped to wonder why? I mean, what's the big deal? What could possibly go so wrong from just one little snack? Well, today we're going to break down the absolutely critical life or death science behind that empty stomach. You know that feeling. Maybe you've been there yourself. The hours just crawl by, and that hunger starts to feel, well, pretty unbearable. It seems like such a simple, maybe even annoying instruction. But as we're about to see, following that one rule is probably one of the most important safety measures in the entire operating room. So let's set the scene. Our story begins with a super relatable feeling. You've got a patient, they're waiting, and man, they are getting hungry. And they're faced with a choice that honestly seems completely innocent on the surface.
Ah, relief. The patient just gives in. I mean, who can blame them? They're thinking, what's the harm in a small snack? It's just a little bit of comfort before a pretty stressful event.
And just like that, a line has been crossed. The patient has no idea, of course, but that one decision has just set a really dangerous chain of events in motion. The clock on that fasting window has officially run out. Okay, so to really get why this is so dangerous, we have to understand what happens when you're put under for surgery. This isn't just taking a nap. It's more like a total system shutdown, all controlled by your anesthesiologist. And then the call goes out. The body's normal functions are about to be, well, taken over. And for that snack that's just sitting in the stomach, the timing could not possibly be worse. Its journey down to the intestine is about to be completely canceled. So from the snack's point of view, everything just stops. The muscles in the digestive tract that were all revved up and ready to go, they suddenly go completely limp. The whole system just freezes in place. Now, what's really fascinating is why this happens. So here's the most important part to understand. Anesthesia doesn't just knock you out. It paralyzes your muscles, and, this is the crucial bit, it switches off all those automatic reflexes that keep you safe every single second of the day. You know, like the reflex to swallow, or to cough if something goes down the wrong pipe. And this visual just lays it all out perfectly. Look on the left, that's your normal, active body. Muscles are chugging along, reflexes are standing guard. But then you look at the right side, under anesthesia. Everything is relaxed, the pathways are wide open, and there are zero guards on duty. The door from your stomach to your lungs is basically just unlocked and swinging open. So with the body's defenses totally down, that food trapped in the stomach is now a ticking time bomb. It can't go down like it's supposed to, which means there's really only one other direction for it to go: up. The food is like trying to find a way out, but the path forward is blocked by those relaxed muscles, and pressure starts to build. And since the little valve between the esophagus and the stomach is also relaxed, the path of least resistance is, tragically, upwards. This absolute disaster of an event actually has a name: pulmonary aspiration. And let me tell you, it is one of an anesthesiologist's biggest fears. It's when stomach contents, we're talking food, liquid, acid, get regurgitated and then breathed right into the lungs. Let's just walk through this terrible journey, step by step. First, the stomach contents are trapped. Second, those relaxed muscles let everything travel up the esophagus into the throat. And since the swallowing and coughing reflexes are totally switched off, the airway is just wide open, completely unprotected. And finally, that material gets into the lungs, a place it should never, ever be. And the result of this? It's catastrophic. The acid from the stomach causes severe inflammation, chemical burns, pneumonia. In the absolute worst-case scenario, it can lead to suffocation and death, all from that one little decision to have a snack. So let's connect this whole harrowing story right back to our original question. Why does your stomach have to be empty? Because the risk of aspiration is very, very real, and it can be deadly. So to recap the really crucial points, anesthesia relaxes every single muscle. It switches off all your protective reflexes. This creates a direct, unguarded highway straight from your stomach into your lungs, and anything that travels up that route can cause devastating, life-threatening harm. So the next time you or someone you know hears that instruction, remember this. That rule isn't about managing your hunger pains. It's a fundamental safety protocol. It's designed to protect your airway at a time when your body is completely vulnerable and literally cannot protect itself.
And that brings our story to its pretty stark conclusion. The doctor's words really highlight how close this patient came to a total disaster before the first incision was even made. A simple rule, ignored, almost led to the worst possible outcome.
It really makes you think, doesn't it? What about other simple instructions, like finish all your antibiotics or don't mix these two medications? They often have equally critical, life-saving science behind them. It's just a powerful reminder that, in medicine, sometimes the simplest rules are there for the most important reasons.